This is David Henry. I'm the Communications Manager for the City of Amarillo. I want to welcome everyone to today's COVID-19 news conference for the latest in COVID-19 information from the Amarillo community. Let me go ahead and introduce who's on our panel here today. We're joined by Amarillo Mayor Ginger Nelson, Dr. Brian Weiss, Chief Medical Officer for Northwest Texas Hospital, Dr. Michael Lementier, Chief Medical Officer for BSA, Dr. Rodney Gonzalez, Director of the Amarillo VA, and City Manager Jared Miller. We'll go ahead and start with some brief statements from Mayor Nelson, and then we'll go to the rest of the panel. Mayor Nelson, how are you today?
I'm well, Dave. Thank you. And good morning, Amarillo. We are fresh off of celebrating this will be the 5th State of the City address and event that we've had here just this morning at Hodgetown. And, last year, the first week in October, it snowed. So we were a little bit nervous planning the event for the first week in October, and God just delivered an amazing, beautiful Amarillo morning for us to get together and talk about some of the challenges, but most importantly, some of the opportunities that we want to accelerate toward in the coming year. COVID is definitely one of the challenges that we want to accelerate away from. And I'm thankful that while it's still hard, and our numbers are higher than we want them to be, we are seeing some shift in our numbers, and grateful for that. So that's all I have, Dave. With that, I'm going to hand it to Dr. Weiss at Northwest Texas.
Thank you, Mayor. Dr. Weiss, how are you?
Oh, good morning, David. So I am hopeful. I think, as the mayor talked about, if you are following our daily report card from the city, which is always well done, you're seeing that we are turning a corner here. We're starting to see a drop in the number of active cases. Now, that has yet to really translate into a significant decrease in hospitalizations, but I am hopeful that that will be coming in the next couple of weeks. As just a quick aside, I got a call from a good friend yesterday I hadn't talked to in a long time. He and his wife are scientists up in New York City, and his wife actually works for the Pfizer vaccine division. And she had the privilege of holding the first vial of a Pfizer vaccine that came off the assembly line. I don't think she's washed her hands since that time, but quite a privilege for her to do that. I do want to bring up one quick thing. I know the last 18 months have been very frustrating for a lot of people, but we are hearing increased reports about hostilities toward healthcare providers. At Northwest Texas, we still are keeping very strict restrictions on people in the hospital. And please, I want to remind everyone, we have lots of elderly people in the hospital. We have people who are debilitated. And then we have people who have conditions that affect their immune system. And we want to do everything we can to protect them from getting any infection in this hospital, particularly COVID-19. So we're maintaining our restrictions until we're sure that we can keep people safe here. So when our staff ask people to wear their masks, or they ask them to keep their distance or limit their visitation, they're doing it because we as an administration are telling them that's important to do. They're doing their job. So I please ask people to understand that our staff are trying to look out for our patients, and that we all have to be patient with what we're trying to do and avoid those hostilities. Quite frankly, we will not tolerate any hostilities toward our staff in the hospital. Now, in regard to the Northwest Texas numbers, so we have 43 COVID patients in house today. Now, remind you, we were up in the 50s. We're now slowly dropping now down to the low 40s, which is very encouraging. That is 8.7% of our licensed beds. That's 18.5% of the number of acute care patients in our hospital. Right now, we have 19 patients in the ICU, and we've been able to actually to go down to one ICU with COVID patients. That's great. It allows us to really help take care of those patients better and to limit their contact with other patients in the hospital. We're using 20 ventilators today total, 13 of which are going for people who are suffering from COVID pneumonia. And we do have one pediatric patient with COVID in the hospital right now. 17 of our staff are quarantined today. We continue to stay about mid-teens in terms of our staff quarantine. And those that are testing positive tend to be people who have not received the vaccine up to this point. We have had 2 people lose their lives to COVID-19 in October. One of those was a patient in their 30s. So again, we've talked about this. We are seeing a lot younger people affected by this. And we are also seeing people in their 30s and 40s who are dying from the virus. Right now, yesterday we had an 8% positivity rate with our testing. We are averaging 8 to 12% over the last 2 to 3 weeks. So again, a decline in the positives that we're seeing that's consistent with what the city is seeing, basically countywide. I do want to say, we've talked a lot about our staffing challenges, and we continue to have a number of visiting nurses who we know will stay at least through the end of October. But what has been encouraging is our holds in the emergency room have gotten down to almost zero at this point. So we're not having people wait for rooms each morning. So what's helping us over the last couple of days is to start to reach out to these regional facilities and try to bring in some of these critical care patients that they've been dealing with. So we know there's 18 patients holding in the region this morning. That's down from the 30. So hopefully we can give more access to these regional facilities who really have been doing a great job of trying to care for people that really need to go to a higher level of care. And finally, in terms of our medications, we have lots of remdesivir, lots of baricitinib, and lots of dexamethasone, which are effective in treating inpatient COVID patients. So I'd ask that even though we're starting to hopefully see a decline in COVID, we need to keep our guard up. Please continue to take the precautions. Think about getting that vaccine if you have not. We know it's effective. Right? And hopefully in the next month or so, we'll be in a very different place than we are right now. Thank you. That's all I have.
Thank you, Dr. Weiss. Let's now go to Dr. Michael Lamentier, Chief Medical Officer for BSA. Dr. Lamentier, how are you?
I'm good. Good morning. Thank you for having me on the call today, and good morning, Amarillo. I think that the comments from Dr. Weiss are certainly on point in terms of things looking a little bit better. We currently today are at 53 total COVID positive patients hospitalized. We've been hovering in the 60s. We peaked with this more recent surge this late summer, early fall, really about 90 patients. So we've kind of been steadily declining from that number, hovering for a while in that kind of 70s range, hospitalized daily, and now down to 53, which is a good sign. To go along with that, our testing positivity numbers are down a bit. So for October month to date, we're at about 16% of all of our tests are coming back positive. We were running higher than that, really closer to 18%, closer to 20% in the past 2 months, respectively, if you will. And again, this is a good sign. Lowering numbers of hospitalized patients, fewer positives with our testing of both inpatients and outpatients is encouraging. So we're happy about that. As far as the composition of those patients that are hospitalized here at BSA, today we have 25 of those in the intensive care unit and 5 additional patients in the intermediate care unit, which is a step-down ICU. The remainder are on our general medical surgical wards. Of those 53, again, out of the 25 that are in the ICU, 20 are on ventilators. And the total COVID census now is making up about 17% of our acutely hospitalized census, which is at 313 today. We have still an ongoing small number of our staff that are quarantined, about 16 staff members quarantined today. That number is down a bit from where we were a few weeks ago, which is good. We are still seeing fair numbers of patients come through our respiratory triage unit in the ER. Anywhere from 30 to 40 patients a day now is where we're running. And again, those can be patients with any type of respiratory symptomatology concerning for either COVID-19, potentially influenza, and other respiratory infections. And again, the theme has held consistent that of all of our hospitalized patients now, 80% of those patients are unvaccinated. 20% are vaccinated of the hospitalized COVID patients. And we're not seeing the severe infection in the overwhelming majority of our vaccinated patients. Those who are vaccinated that unfortunately are getting severe infections, and some that are succumbing to disease have chronic immunosuppressing conditions, multiple medical comorbidities, or they're on medications that suppress their immune system, which is a very common theme we're seeing for those individuals as well. We're in good shape right now in terms of our ventilator capacity. We're using less than 50% of our ventilators, which we're happy about. We have a large contingent of contract labor at BSA still. We have about 55 nurses that we've hired as travel nurses here currently, and we have about 56 RAC staff, combination of ICU and med-surg nurses, and we also have about 10 respiratory therapists that are also here from the RAC as far as that support staff. So again, that's a large workforce contingent that we need still to keep our maximal beds opened. And we're hoping that as the numbers continue to decline, obviously we're going to have less reliance on that contract staff, and hopefully we'll have some more of our nurses that have historically resided in the Amarillo area that are traveling come back and to both of our hospitals here in Amarillo and resume positions there is one of our hopes. One thing I'll mention is that there's no question, and I've had this discussion with many of our ongoing staff members who have at this point still not been vaccinated primarily. There's no question that the data is very strong. The evidence is very clear that vaccination is preventing you from getting a serious and potentially fatal COVID-19 infection. It's very difficult to refute that data. It is also very difficult to refute the fact that the adverse effect potential from vaccination is very minimal. And again, that is something that I think folks really need to understand and appreciate. And please go to references that are reliable. Go to reliable healthcare organizations in the country that we know publish information about COVID-19. Go to the National Institutes of Health. And yes, go to the CDC and look at those resources in terms of what your best protection is. Beyond that, there are additional medications that are in development to help us combat COVID-19. And the most exciting of which is an oral antiviral that is beginning phase 3 trials as of this past September 1st. That drug appears in preliminary studies to have good activity against COVID-19. And the question is, will this be available under an EUA, early use authorization, just like some of the other medications we've had available to this point, by potentially as early as Q1 of 22. And that would be an oral medication that can be taken for individuals who are infected early in the course of disease. So again, that's exciting that there may be an additional opportunity for us to combat this virus. It does not supplant the need for vaccination, which is the most effective way to prevent infection and severe disease. But this could be an adjunct that really helps us combat disease and keep people out of the hospital. I would say analogous to the monoclonal antibodies, that we know are very effective in keeping people out of the hospital, but a little bit more cumbersome to administer because of the intravenous or subcutaneous route that has to be used instead of a pill, which would be a very good option for us. So again, numbers are a little bit better. We're encouraged that that's happening. I'm still a little bit apprehensive about flu season. Make sure you get your flu shots. Protecting yourself against the flu is another way to help prevent against a co-infection where you potentially get COVID-19 and the flu, which would not be a good scenario. Hopefully we have another mild flu season. I don't know that we can count on that, but we're really certainly hoping for that. And masking when you're in the right environment in terms of a higher risk environment, especially if you're not vaccinated, is something you should do to protect yourself and to protect others. So again, we want to thank all of our staff here at BSA have been continuing to work tirelessly through the pandemic and this most recent surge. I did a fair amount of rounding with some of our nurses this past week and some of our physicians, and they are worn out. They're tired. As Dr. Weiss mentioned, sometimes they're getting some resistance that really is unwarranted. Remember, they're here to help you. They're here to help you and your family members, to keep you healthy, to get you back home and get you through any infection or acute illness that's brought you to the hospital. So please treat them with the respect and dignity they deserve. And thank you for letting me speak today.
Thank you, Dr. Lementer. Let's now go to Dr. Rodney Gonzalez, Director of the Amarillo VA. Dr. Gonzalez, how are you?
I'm doing well, David. Thank you. So first, I'll just go straight into our numbers. Currently, we have 4 COVID patients here at the Amarillo VA, 3 of which are in the ICU. You know, as Dr. Weiss mentioned, the patients waiting out in the region, I'm happy to announce that 2 of those patients we were able to get from the region. One was a veteran in the Texas Panhandle area, and one was a veteran in the Oklahoma Panhandle region. And so great to help out throughout the community, you know, when we have the ability to assist on those hospitalizations. As Dr. Lamentier mentioned, I too want to encourage the COVID and the influenza vaccination. We continue to offer the COVID vaccination here at the Amarillo VA for our veterans. We offer the Moderna and the Johnson & Johnson vaccine. And then we already have the influenza vaccination. As I think I mentioned on this call a couple of weeks ago, I was at a regular appointment, and while I was there, they said, "Hey, do you want to get vaccinated?" I got vaccinated while I was at that appointment. But for veterans who may not have a appointment right now, we are going to offer our influenza vaccination October 18th through 23rd. That is a Monday through a Saturday here on the Amarillo campus from 8:30 a.m. till noon. And that will be in our parking lot L, which is sort of near the behavioral health, mental health building on sort of the southwest corner of the campus here. Also want to mention that October is Breast Cancer Awareness Month, and we will be having a teletown hall specifically for our women veterans on October 21st. And so look forward to that and letting our women veteran know what resources we have and how we can assist them. And then the other thing I wanted to mention is I just want to say happy birthday 1 week from today on October 13th to all of our Navy veterans, as the Navy will be celebrating its 246th birthday. As many know, I'm a West Point grad, and I always say go Army, beat Navy. But this is one of those days I really appreciate. And my PAO likes to remind me, because I tell the story, is I wouldn't exist if it weren't for the Navy, because my grandmother was a Navy wave and my grandfather was in the Navy, and that's where they met. So I do have to appreciate the Navy for that reason, if nothing else. So fair winds and following seas to all of our Navy veterans. And once again, thank the city of Amarillo for this opportunity. Jared, I think I saw that thumbs up there. Just thank the city of Amarillo for this opportunity.
Thank you, Dr. Gonzalez. We're now good members of our media. You're in attendance. If you have a question for the panel as a whole or an individual panel member, that's perfectly fine. Let's go ahead and start with Michael Cavello of the Amarillo Globe News. Michael, how are you? Try it one more time. Let's go with Michael Cavello of the Amarillo Globe News. Michael, how are you today? We'll come back to Michael. Let's go to Dalton Williams of KBI Channel 7. Dalton, how are you? Seem to be having some audio difficulties here. Okay, hold on. We will pause for just a second while we check out these audio difficulties.
Hi, David. How are you? Can you hear me now? Hi, can y'all hear me?
Yes, Dalton, we can hear you. We got those fixed. Go right ahead.
Okay, perfect. So my first question is, like both Dr. Weiss and Dr. Lamentier have said, we've seen a decrease in cases and stuff. What would y'all attribute this kind of mass decrease in cases to? Would it be to masking, more increase in vaccines, or what would y'all say would be the leading cause of these big decreases?
I don't know. Say it's tough to tell. I think we got past some of the key holidays and things like that. I guess we were on a call last week, and Dr. Bell, who I wish was here, kind of mentioned he thought maybe we were actually hitting somewhat of a herd immunity between the people who are vaccinated and the people who have incurred the virus and done well with it. So it's hard to tell, but Dr. Bell seems to suggest that maybe we've hit that point where the virus is just kind of burning out in the community.
Dr. Lamentier, did you have anything?
Yeah, I agree. I mean, I think that the combination of vaccination, native infection, hitting a little bit greater of a saturation point is helping us with virus burnout to a degree. And I think that I guess what I would also say is that the numbers are down. I don't know that I would say that they're dramatically down. In other words, we still have a large number of patients hospitalized in our city. 53 here, 40 some at Northwest. That's almost 100 patients hospitalized. So I don't want to over exaggerate the decline. Very happy about it. And I think it is a significant decline. But let's let's make sure we're still being very careful to understand where we are here. We have a low vaccination rate in our community. We have a low vaccination rate across our state. That's a problem if you start thinking about predicting where we could be here in the next couple months. That's why we're continuing, all of us on this panel, to encourage vaccination, because we know that's the best way to prevent hospitalizations.
Exactly. And then kind of going off of that, being cautious and exiting some of the major holidays. I know we're only a month away from Thanksgiving and 2 months away from Christmas. Are there any kind of concerns of spikes from that, or are we kind of trying to be as preemptive as we can for those upcoming holidays?
You know, your best defense again is vaccination. I mean, I want to enjoy the holidays as much as everybody else, and I think we all are in that same boat. And I feel very differently when I'm out and about around a group of individuals that I know are vaccinated than I do when there's a crowd that has, you know, a composition where some aren't or many aren't. And you don't always know that. Obviously, it's impossible to know that unless you know the entire party that you're mingling with. So I think we just need to try to, you know, use common sense for those family gatherings. You're going to have a good idea of your family members who are vaccinated. You're going to have a good idea of who is having symptoms that may be concerning and needs to be maybe not attending the event. But those are the types of things that you have to just use some common sense, I think, and good judgment in terms of deciding how you can gather, because gathering is important, especially with your family around the holidays.
I would certainly agree with everything Dr. Lamentier said. I kind of echo what Dr. Fauci said recently, which is it's just too early to really predict where we're going to be at those points. I mean, the hope is that, you know, and Dr. Fauci did say that, you know, if you're vaccinated and the family's vaccinated, you can certainly gather with more confidence than if not vaccinated. But there's still a lot of variables, you know, to that time. But hopefully we'll be at a place where the holidays will be able to proceed without too much problem.
And then my final question, can either you, Dr. Weiss, or Dr. Lamentier talk about the new kind of treatment methods for COVID symptoms that we're seeing, and kind of like how they've been different than those of the past?
I'll start, and I'll start by saying I'm not aware of any different treatment modalities we're utilizing for the symptoms of COVID. I am aware of the extensive treatment protocols that we have on the inpatient side that involve medications that are either FDA approved or have been shown to have benefit in good trials or are under an EUA. And that starts off with things like steroids, antivirals like remdesivir, and then some other immunomodulating drugs that affect the immune response, interleukin-6 antagonists, and drugs that are called JAK inhibitors, JAK, that also affect that immune response for people that are having severe, really kind of that pre-acute respiratory distress syndrome. The other therapies that I mentioned earlier in my statement was really an oral antiviral drug that the pharmaceutical company Merck is developing now and has in phase 3 trials. And I think there'll be others. Those are the things that really are at the forefront of what we're doing for COVID. Otherwise, it's supportive care for the symptoms that folks have, and it's the things that we do to treat the aches and the pains and some of the symptoms of shortness of breath. Obviously, oxygen, if those individuals are low in terms of their oxygen levels, that's really those are the mainstays of our therapies.
Okay, perfect. Thank y'all so much, and thank y'all for having me.
Thank you, Dalton. Let's now go to Aaron Langston at KAMR Channel 4. Aaron, how are you?
Good. How are y'all?
Good.
First question is, we've seen a pretty steady decline in recent weeks on the number of active cases, but the hospitalization rate has inched down much slower. Is there a reason for that, or is that just you guys being able to take in more patients from outlying areas that you weren't able to before?
Aaron, I'm sorry, let me understand your question. You're asking about why we were able to take more in at this point, or?
Well, just wondering if that's the reason for the hospitalization rate going down slower than the cases.
That's a good question. So the answer is not yet. Now, keep in mind that, and we talk a lot about this, is unfortunately COVID patients, particularly the ones in the ICU, their length of stay can be weeks, if not months in duration. So unfortunately, when these patients are admitted, they stick for a while. And so that's part of it. I think we're still seeing patients in Northwest that have been with us for a while, and unfortunately will continue to be with us for a little while, just because of how sick they're getting. And the answer is yes, we are trying to bring in some of these patients, particularly the critically ill patients from the region, but it just, a lot of it's just the length of stay that we see with these very sick COVID patients.
All righty. And with the talks of kids 5 to 11 possibly being eligible for the vaccine soon, what are your recommendations to parents that might be on the fence on that?
Yeah, I mean, it's always a difficult question for folks that are reluctant or apprehensive about moving forward with vaccination. Again, drugs like this, and the vaccine is obviously a drug, and we use that terminology broadly to prevent COVID-19. When they are approved under an EUA, again, there's data that's being culled through that has been shown in well-done trials to be safe and effective. Otherwise, there would not be this EUA that comes out. And again, we know that the potential for transmission of COVID-19 amongst our children certainly is a reason for us to have ongoing disease presence in our community. So I really think folks should reconsider the risks and benefits of their children based on their unique health concerns, and also the potential for them to get a severe COVID infection, which is less than it is in adults, but it's certainly not zero. So they have to make that individual decision based on their child's risks and benefits, and make that really about the child's health first and foremost. I think that's the only guidance that I would say in addition to what I've commented on.
All righty. I think that has me covered. Thank you very much.
Thank you, Aaron. Let's now go to, if I'm not mistaken, Kevin Welch of News Channel 10. Kevin, how are you?
Hi, I'm good, thanks. Dr. Weiss, can you talk a little bit more about the outside staff at Northwest, hired and RAC?
Right. So well, we really are mostly RAC dependent right now in terms of traveling nurses. I believe we've got, I know we have 50 plus in terms of those nurses. We also have a number of respiratory therapists also through the RAC. So, and what I do know is that we've been assured that they will stay until the end of October at least. But that's kind of where we are with regard to our traveling staff right now.
Okay, and Dr. Gonzalez, can you talk a little bit about the trends in the veterans community as far as not necessarily hospitalized, but infections?
Yeah, so much like the community at large, we are seeing a decreased number of new active cases. And so we are seeing that downward trend. We look at our positivity, it's very similar across the board. And so, and remember, our veterans are just a segment of the overall community. And so that is not a surprise. Now, I can say this is, our veteran vaccination rate tends to be a little bit higher than the community. I think the last I saw, we were about 58% of our veterans vaccinated that we track here at the Amarillo healthcare systems. That includes here and down into Lubbock. So, but not a surprise that we're following the trend of the community of seeing a downward trend of new active cases.
Okay. And previously, Dr. Lementer and Dr. Weiss, you said that if there were any mandates for vaccination of staff, it would come from the corporate level. What's the status of that?
At this time at BSA, we're watching very carefully what's happening, nationally in terms of our administration for the country, the president, and the mandate for healthcare workers potentially being active as early as November. Obviously, there's no firm timeline there, but we're watching that carefully. We're also talking within our internal health system that has 30 hospitals across the country to see where it makes the most sense to move forward earlier. Our New Jersey hospitals have mandated vaccination, and things have gone well there, but they started off with a very high baseline vaccination rate that was around 70% or higher. I was reading an article today that talked about one of the largest New York state healthcare facilities ended up having to terminate about 1,400 employees across all of their hospitals. That was a concerning statistic. And again, that was because of their vaccine mandate. I think from a medical standpoint, absolutely, it's the right thing to require healthcare workers to be vaccinated. From a practicality standpoint, in terms of where we are with nursing, staffing, and being able to care for our patients in the community, we are concerned about attrition of additional staff members who don't choose to be vaccinated, then not being in the workplace. It's a real concern. So what's the balance? What's the right timing as far as being the best for our patients, but also the best for our community in terms of having resources to care for sick patients, not just with COVID, with all kinds of medical conditions, obviously. So that's where we are right now. We have not made a decision about moving forward. I think it's an eventuality for all healthcare systems across the country.
Yeah,
Dr. White?
I would say the same thing is, obviously the president has decided that vaccines will be mandated for all healthcare providers. I can tell you, we just got through the influenza vaccination period in the sense of, the state mandates influenza vaccines for healthcare providers. We are at risk for losing some of our personnel because of their declining to receive influenza vaccine. So I do think, as Dr. Lamentier said, is that balance between knowing that we have to do this, and this is the right thing to do, whether it be influenza or COVID, but also know that we have to run the hospital and continue to take care of people. So we're kind of in step with BSA. We know that when we do mandate it, that probably both hospitals will work together to do it together in a sense of to make sure that the staff understand that you can't cross the parking lot to escape getting a vaccine.
Mm-hmm. And Mayor, given any thought to some new messaging for as far as getting vaccines? Kind of plateaued a little bit there.
Really, the message is still the same message that we've been talking about, and that is the safety of the individual who gets the vaccine. All of the data shows that it will decrease the chances of your need for hospitalization, and it will increase the chance that you will survive COVID. So that data is it's just beyond a doubt clear that it's safe for you from a COVID point of view to get the vaccine. People begin still to have questions about how safe is the vaccine itself. Over 100 million vaccines have been given. And the number that I tracked last week through the CDC was about 8,000 deaths related to anaphylaxis or something else that might have been tied to receiving the vaccine. So, 100 million to 8,000, I understand those are 8,000 real people. But the numbers on a meta scale are clear that you're not likely to be one of those people. Last week I was in New York City, obviously, and the topic of vaccines came up. And in this room of really impressive leaders, other mayors from other cities, I stood and asked a question to one of the public health experts that they had. I was in the same room as a mayor who has 96% of her city vaccinated. And one of the questions I asked was, have you, in the high level conversations that you're a part of, have you heard anyone begin to discuss that vaccines may no longer be free? Because if so, I feel like we need to know that. And I was relieved to hear that in the conversations she's participating in, that she's not heard any conversations about vaccines not being free. But at some point, that change may come. And we may need to, as a city, begin to address how do we continue to pay for and offer free vaccines, because we certainly would never want cost to be a barrier to someone getting a vaccine. So I don't know how to message it any differently. I do want to respect people who are investigating, people who are questioning, people who are curious about the vaccine and its health effects. I just want them also to be curious about COVID and the effects of getting COVID. And I'll share very openly, I'm right at 11 months post-COVID, and I have some long hauler symptoms. And I very much so wish that I had not had COVID, because I can't smell, and there are things that I can't taste. And as far as we know, that's looking like that could be the rest of my life. So it just, to make light of it for a minute, I can't smell or taste bacon. And that's a biggie. So, whatever it takes to motivate you, maybe bacon would do it for you. If that's a new message that I haven't tried out on people, then let's try it. I do miss tasting and smelling bacon. But what I really want is for people to know that the vaccine saves lives. And I heard of a family last week who lost their son. He's in his 30s, no underlying conditions, newly married. He's been married just 4 or 5 months. And this came out of nowhere. He got COVID, and they were shocked that he went severe quickly, and he died. And I just am devastated for that family. So I don't want us to not be telling those stories too. And I want very much so for our community to be safe, both as individuals and as a group. Hearing the doctors talk about the group health, the public health, the herd health, that's real. So if you're not vaccinated, it does affect you, but it also affects us as a city.
Okay. Sorry about the bacon, Mayor. Thank you, everybody.
Well, I know that was a really long answer, Kevin. There's a lot on my heart. I don't know how to motivate folks who have not chosen to do it, but it does weigh on my heart heavy.
Gotcha. Thank you, everybody.
Thank you, Kevin. Let's now go back to Michael Cavello of the Amarillo Globe News. Michael, how are you?
Well, can you hear me now?
Yes, we got you. How are you, Michael?
I'm doing good, and thank you for participation. Back to vaccinations. There's a lot of hesitancy, and there's a lot of information out about bad reactions. And the mayor just brought up about the 8,000 out of 100 million. What are some of the indicators that a vaccination may have a bad effect on an individual? Like, what individuals would be most likely to have an adverse reaction to a vaccination, if anybody could answer?
I can start off with a couple comments, and what I would say is that we've got to be very careful too about when we say there's a adverse event and there's a true cause and effect association. So just because someone has a adverse health consequence subsequent to a vaccination does not mean that the vaccination induced the adverse health event. Obviously, if there's a temporal association and close proximity in time between the vaccine and an event, that makes you more concerned and more curious. And certainly, there are some people that do truly have adverse reactions. One of the things that's been present since the beginning of us administering vaccinations as far as a precautionary tale is if you have a history of anaphylaxis to prior vaccinations. So if you've gotten a vaccination in the past and you've had anaphylaxis, which is a severe systemic allergic reaction that really creates a shock-like state, it needs to be managed very emergently with drugs like epinephrine and additional supportive care, because people have very low blood pressure, their capillaries become leaky and they become shocky. So we have to treat those people aggressively with specific interventions. If you have a history of anaphylaxis, those are individuals that certainly need to have some concern and should consult with their primary care provider specifically about their unique health history and whether or not the benefit of vaccination outweighs the risk. That, I would say, is really first and foremost. Or if someone had already received one of the COVID vaccinations, say the first dose, and had a significant adverse reaction that their physician felt was associated with that vaccine, then those individuals almost certainly should not proceed with additional COVID-19 vaccines. And again, some of those could be that they had, for instance, a severe clotting disorder that was close in proximity to a vaccine. We've heard some of those reports. Those are individuals that really need to be managed very carefully. But that does not mean that someone who has a sore arm or a little bit of a rash on their arm, or sometimes we see, quite frankly, some what we call psychosomatic reactions where they're having an anxiety attack because of all the anxiety that's around COVID and vaccinations. Sometimes mind over matter causes some reactions in patients that have the vaccine, which is not a true allergic reaction. So there are a few things that make individuals contraindicated, we say, for vaccination, but some things that certainly warrant consultation with your primary care provider.
Any other questions, Michael?
And I guess somewhat related to that, so we still have a fairly low vaccination rate. And when we talk about, people dying from COVID, a lot of people like to point out that there's such a low rate of people actually dying. But those same people will use numbers that are even more not in their favor, such as the people having any kind of reaction to vaccinations. So what is special about this community that just has created like a problem getting a higher percentage of vaccinations, at least in some people's opinions?
Michael, I just do a quick thing. So, I don't think there's anything special about this community. I think, a number of communities are struggling with the same decisions. I want to remind people, we don't make vaccines to benign conditions. Okay. There's no vaccine to the common cold. There's no vaccine to ringworm. Okay. These are benign conditions. But we do vaccinate people against measles, meningitis, mumps. Okay. And these are all viruses that you could argue, well, if you go back, a lot of people would get those viruses and may get a rash and then do well. But a number of people died from those viruses. That's why we made vaccines against them. I think COVID-19's in that same group. This is a virus that has incredible potential to take your life. But then, as the mayor pointed out, is we don't know the long-term complications. And we do know that there are people who are suffering months, after the virus from the brain fog or other long-term, these long haul syndromes. And then what we don't know is what about 10 years down the road? If someone suffered the myocarditis, which is the inflammation associated with this virus of the heart, maybe 10 years down the road, the heart suffered enough damage, they go into heart failure. We don't know. So I think that's why it's so critical that we have made this vaccine for a reason, because this is a dangerous virus and it joins the rest of these very dangerous viruses that we've decided we have to protect ourselves from.
That's all I have. Thank you.
Thank you, Michael. Those are all the questions that we had from media. This concludes our news conference for today. I want to thank all of our panel members who took the time to provide this information to the community. Once again, this is David Henry. I'm the Communications Manager for the City of Amarillo.